You are here on From Dirt We Grow with your host, Stephanie Allen. I appreciate you all for being here. And today, my guest is someone that has seen healthcare from the inside. She's a medical biller and coder, among the other million talented things she does. But she's not going to be afraid to tell us kind of the inside, a little bit of the corruption that goes on in there, the whole money funneling to the top kind of system that we know that healthcare is, that some people may not see. So let's get in there and talk to Steffi. Welcome to the show today. Thank you for being here.
Thank you for having me.
I'm happy to have you tell the people the truth, and hopefully we can get some people woken up to what's going on. Tell us a little bit about yourself before we jump all in there.
Sure. So, my background is, like you said, I'm a medical coder, I'm a medical auditor, documentation specialist, and compliance officer. So, my world really is the backside of healthcare and what goes on behind the scenes. I have some expertise in fraud, waste, and abuse. I've worked in many different settings through hospital systems. I've worked for one of the biggest insurance companies in the United States, and I've actually taught all of this to people off the street and doctors and nurses.
What's something that maybe the average person who doesn't know about what you do?
Sure. So, first, I want to kind of talk about what coding is because a lot of people have no idea how important it is to the entire system. So, what coders do essentially, when you go see a doctor, you go to an office visit, the doctor will write down their diagnosis, what happened in the visit, and attach a procedure to that as well. It all goes in their doctor's note. That note goes to the coders, they review it, they will pull the diagnosis out and attach the appropriate alphanumerical code to that. They'll pull out the procedures that the doctor said they did and assign the code for that. And those codes are what goes on the claim form that goes to your insurance company. And that's kind of a big part of how they determine what they're going to pay for service wise when it comes over to them. So that's why it's so important. No one can really get paid in the healthcare system if coders are not doing their job
Mm.
appropriately.
So you see a lot of numbers on day to day.
Oh,
Um,
yeah. Yeah.
yeah,
I see all the numbers. So I
all the
have a good
numbers.
idea of how much procedures cost. I think that's kind of eye-opening for people to realize how out of whack our system is, how much things actually cost, and why they cost that much.
I mean, do you see a disconnect? Are you privy to how much a procedure would actually cost versus what we're being charged for that?
So without it, and here's the problem
Mhm.
is there's so many different insurance companies and coverages that it's almost impossible to be able to tell the patient without like calling the insurance company and saying, "Hey, how much is this procedure going to cost? How much it's going to actually cost by the time the patient gets the bill?"
Um,
Remember, I see all different kinds of claims, I see all different kinds of healthcare settings, and there's a couple that really blow my mind that like if you are having like a problem with your finger where um you can't get it to straighten out and it keeps kind of curling in on itself and you go to the doctor and they end up saying, "Hey, let's do an injection." Blows my mind when I see that that injection, just the drug itself, is over $19,000.
oh my,
Why would
that,
none of us can afford that?
that's insanity. $19,000 for one shot in the finger.
Yeah. This kind of gets into the conversation of how much more acute care costs than preventative care. So, for example, an average ER visit just to go to the ER is anywhere from $1,500 to $3,000. Urgent care is at least $200 a visit. Heaven forbid you have to be end up in the ICU. That's a minimum of $50,000.
You are kidding me.
Not at all. A cardiac catheter procedure, so to help save your life, is anywhere from $4,000 to $8,000, and the average hospital visit is $15,000 to $20,000.
The average hospital visit?
hmm So like inpatient stay, like you are up on a hospital floor, inpatient
Um,
stay, $15,000 to $20,000.
that is sickening.
It is. And imagine someone coming in and not having health care and having to healthcare coverage and
I
having to pay for
can't.
that out of pocket. The number one reason for bankruptcy in the United States is because of medical debt. How are people supposed to get ahead when things cost this much when we can't even be able to afford our health insurance at this point?
I mean, yeah, and it's not even a matter of keeping yourself healthy. I mean, accidents happen, you know. Oh my
Yeah.
gosh.
Mhm.
Now, you talked about preventative versus acute care. I mean, preventative care is obviously smarter, more beneficial as far as our pocketbooks go, right?
Mhm.
So, why isn't that being done?
We really need the system to keep pushing the importance of preventative care because preventative care overall will cost us less money. And overall, our healthcare outcomes are obviously better if we're taking care of ourselves regularly and not pushing stuff off. But comparatively, would you rather pay $250 for an office visit once a year, or which your copay for that might end up being $30? So you may end up paying $30 out of pocket a year, as opposed to just, waiting and finding out, oh, you have, you know, a really bad heart problem and end up in the ICU. Like we got to get out of the mindset of, I'm okay, I can't afford preventative care. I'll just wait until something big happens, because it's when something big happens that we end up with all this medical debt and end up with bankruptcy, which then bankruptcy affects so many other aspects of your life, right? It
Yeah.
affects the ability for housing, some jobs. Look at bankruptcy past, history. Like,
Mm.
so medical debt really, really messes with people in a big way.
Okay, break it down. How much money actually does flow through the healthcare system?
About $4 trillion goes through the healthcare system annually. And of that 4 trillion, the number that really shocked me when I started working in the system is that estimates for fraud, waste, and abuse in the system of healthcare exceed 10%. So $300 billion a year
Wow.
minimum of healthcare fraud, waste, and abuse.
That also is sickening.
hmm the biggest culprits of that are for services not rendered. So doctors saying they provide services that they're
Mm.
actually not providing. Um, Upcoding, which means a doctor is charging more for a service than their documentation supports. We see that a lot. And it's definitely an area that needs to be worked on. And I want to say the biggest issue with fraud in our healthcare system is because of providers, not because of patients. I want to make that very clear, because I know that there's a lot of misconception out there about, right now we hear a lot about undocumented immigrants and how, we hear people saying, oh, they're a drain on our system because they get healthcare benefits. And I want to correct that and say, no, 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 no. Undocumented immigrants do not get any type of federal health care whatsoever. There's some state rules that allow for very small amounts of populations to have access to healthcare, but it's not like sweeping or nationwide or anything like that. It is minimal and it is state funded. So nothing federally funded. So when we hear that, people are like, well, then why can undocumented immigrants go to the hospital? Well, everybody can go to the hospital. They're
Mhm.
covered under a law called EMTALA, EMTALA. And that essentially states that a hospital can't turn you away when you are in need of emergent health care, or if you're a pregnant woman in labor. They cannot turn you away. They have to see you and evaluate you before determining, like, and they have to make sure you're stable before determining, okay, does this person need to go to another hospital? Are they safe to discharge or whatever? I want to make sure everybody knows about that.
So,
Other fraud, waste, and abuse in our system.
mm,
So we talked about services not rendered and upcoding, but unnecessary procedures, that is a component of some of the waste and fraud we see. And then a big one that I feel like we need to do more in our system with is kickbacks. And that's benefits to the doctor or the healthcare system. And there's a specific law in place, but I don't think it's, sweeping enough. It's called Stark Law. Stark Law is a federal statute and it prohibits physicians from referring Medicare or Medicaid patients for specific health services where there's a conflict of interest and they could financially benefit in some way. So it's
Mm.
essentially a way to keep that system from having that conflict of interest, but we need a lot more laws that have to do with how healthcare entities and health insurance companies communicate with our Congress, because I see a lot
Mm.
of patting on the back there.
As the coders, do you or can you push back? Can you question things like that?
We absolutely can, yes. A specific example is I'm not going to name the health insurance company I used to work for, but it
Mhm.
is one of the biggest in the United States. And personally witnessed where we found some fraud, brought it up to management, and asked management to follow appropriate steps to report it to the authorities, and they did not do that. Come to find out is because they were benefiting from that fraud. They were
Mm.
making money off of it. So we ended up having to, one of my coworkers reached out to the Office of Inspector General and spoke with the DOJ, and they did something about it.
Okay.
So,
Something good?
well, they charged the doctors, but the
Mm.
healthcare insurance company has gotten off scot-free. And again,
Mm.
that's because they have very close relationships with congressional members in a way I don't think is appropriate.
Yeah.
As a coder, our first line of defense when we're not sure about what we're looking at is to query the provider. So we can
Mm.
actually ask the doctor, hey, what is your intention with your documentation here?
Mm.
There's rules about how we can even talk to the doctor so that we're not leading them to report it a specific way that is
Mhm.
connected to reimbursement. So we have really strict rules as coders that we follow to make sure that we're not manipulating the doctor's thought process to increase revenue. But there are a couple different scenarios, and a couple that I see frequently is upcoding. That's one I mentioned, and that's where the doctor sees you for a visit. And this is something I see almost every day in my
Mm.
job. Um, you see a doctor for a visit, and physicians can bill based on time. So the doctor writes in their documentation that I spent 30 minutes with the patient, and they do that for every single record that they saw the patient for that day, but they saw like 25 patients. How did you do that in an 8-hour day? The math doesn't
So,
math.
yeah, the math ain't mathin'.
So sometimes doctors will write uh, their services based on time just so they can claim a higher level of service and therefore make more money.
Wow.
hmm Doctors have ways that they try to manipulate it every day. In my career, I've personally found at least $100 million worth of fraud, waste, and abuse.
Wow.
Just me.
You alone.
So, yeah, if
Yeah.
you extrapolate that out, it's a lot of money that we are just throwing down the drain. If we to kind of move into the idea of how we can fix this system, because man, there's a lot we need to do. I am a big proponent for universal health care.
Mhm.
And we could save $450 billion just by switching to universal health care.
How much?
450 billion with a B.
Wow. That's a huge number.
Yeah, yeah.
So
Just from switching
why is it so much pushback?
because insurance companies, they want to keep making their money. I
Mm.
actually have some figures for you on how much money the top
Let's
insurance
go.
companies earned in 2025. You can see how much money is in this system and how much they're making off of our suffering. Um,
Who is the bigger hand in this, though? Is it the insurance companies or is it the pharmaceutical companies?
I'd say
Right.
health insurance companies because
Okay.
they kind of are the bigger umbrella of some of the pharmaceutical stuff that goes on.
Okay. I was just wondering
But
if.
yeah,
Yeah.
yeah. A couple these are the biggest insurance companies and how much the money they made in 2025.
Okay.
Again, off of our pain and suffering. Optum, which is an offshoot of United Healthcare.
That's the veterans one, by the
Mm.
way.
I have some information about VA stuff to talk about
Mm.
too.
Okay.
So Optum made $270 billion last year.
Profit.
Yes, profit.
Ugh.
United Healthcare, $447 billion last year. Blue Shield, 197 billion.
Mm.
Humana, 129 billion. These are all billions, not
Billions with a
millions,
B.
billions.
Yeah. Oh my god.
Centene, which is also an offshoot of like United Healthcare and Optum, they made
Mm.
194 billion last year. Cigna made 274 billion last year.
Mm.
They prioritize shareholders over the well-being of the patients. And
Okay.
one of those reasons is because they're not healthcare professionals.
Mm.
Um, some of them are tech bros, like Andrew Whitty, the I don't know if he's still the CEO at this point of Optum.
Mm.
He was he came from Apple, so he just looked at things like numbers
As they do, I
instead
suppose
of
I'm
people.
seeing. Yeah, yeah. It's running just like our politics basically right now, for sure.
Yep.
Since.
hmm That's how much healthcare insurance companies made. And then let's go down a rung to how much the hospital like CEOs and stuff made,
Mhm.
because that's a conversation that needs to be had too. CEOs are making like $600,000 on average, just their base pay. Um, but with like shares of the hospital system as their compensation, I've seen pay easily balloon on average to $11 million
Mm, mm.
per year, while our nurses are making about $95,000 a year.
Wow.
That's the pay inequality
Did you
in the
say
healthcare
11
system.
million or billion? 11 million.
Million,
Okay.
million with an M.
11,000,000, 95,000.
Yeah,
Quite a gap there.
that's right. Yeah,
Wow.
blew my mind when I started learning about this. And there's actually a healthcare system close to me that this happened to recently within the last, I think it was around COVID. Um, the healthcare system decided that they were not going to pay out their workers a cost of living increase in their pay because remember back then everything started getting more expensive. Then the hospital staff found out that the CEO made $14 million that year, and the hospital system said that they didn't have any money left after spending money on creating a new hospital logo.
Oh, oh,
Yeah,
you've got to be kidding me.
to all those frontline healthcare workers, that's what was said to them: is that we think you're being paid fairly as to market standards, which they are not.
Because we
Why?
needed
Like
a new logo.
because we needed a new logo and had to pay our CEO $14 million that year.
Oh, oh yeah, that too. Yeah, right, right, right. Don't forget that guy. Oh my goodness. Gosh gracious. I don't even have the words.
So money, we there's so much fraud in our system, but it's not where they want you to think it is. It's not patients. Because
Mhm.
as a patient, you have to, for most like procedures, it has to be deemed medically necessary. There's usually a lot of paperwork that has to be done to have it pre-authorized by the insurance company and all that. And even after everything goes swimmingly, at the end of the day,
Mm.
if the insurance company is like, no, we don't want to pay for it, they can deny it and they can come back and deny things afterwards too. Like, I've seen that happen where they've changed their minds. Um, one of the things that alarmed me when working in on the health insurance side of stuff is that my supervisor actually said this to us: is denying patient claims is how we make our company money. I'm like, I cannot believe you just said that out loud.
Wow, he really did, huh?
Really did.
Wow.
So that tells you exactly where their minds are. It's all about money. It's all about profit. They do not care about the people. We saw where Blue Cross Blue Shield was trying to only pay for 7/8 of people's anesthesia that they needed for a procedure. And they just weren't going to pay the other part of it, expecting the patients to
Well,
have to pay for it.
well,
And then the thing happened with Luigi Mangione, and so they
mm,
kind of backtracked on that.
I mean, I don't
Yeah.
even. I said blow my mind, not like completely like take it out of my head and stomp on it. No.
The
Oh my
system is
god.
messed up. There's so much that we can do to fix it. I have some ideas for how we can fix this stuff.
So yeah, what are you thinking?
So I think there's two different like buckets that we need to work on here. First of all, we need universal health care.
Mm,
Like I said, we'll save $450 billion a year just by going to a single payer system.
mm,
So taking out all the time that it takes to figure out which insurance companies cover which things and all the
mm,
pre-authorizations and all that. We would say $450 billion a year by doing that.
okay.
We need to create more incentives for nurses, physicians, frontline healthcare staff to go into high demand careers. We don't have enough eh, physicians in specific specialties, especially with baby boomers aging. We're going to need a lot more
Mm,
people. The problem is education is prohibitive. It costs hundreds of
absolutely.
thousands of dollars to become a doctor, and they're not making enough money to support them going into those careers. We need to prioritize patient health and outcomes over profit and shareholders.
Hmm.
We
Bottom
have
line.
to, yes, we
It's always the
have to
dang
start
bottom
taking
line.
care of the patient. We definitely need stricter laws about anti kickback. Uh, like I said, stark laws in place, and that keeps some of that at bay. But there's some really deep rooted relationships between some of the big health insurance companies and some of the pharmaceutical companies, as you know, um, and these health insurance companies and stuff with Congress, and those are the people that control the legislation that goes on in all these areas. Um, I think we need some more legislation in regards to that relationship and keeping those two things much more separate than they are. I think that health insurance companies get away with a lot because they have some friends in high places.
Hmm. We talked about veterans a little bit here, and you said you had some more information on that.
Yes, because you're a veteran and you and I were talking about this in a
Mm,
live, how veterans care is just atrocious. First of all, it drives me crazy that veterans can't have to go to a specific VA hospital or
mhm,
clinic that they can't go what's convenient to them.
mhm,
I've had friends, I've seen patients that need care and end up having to drive hours away to get it because
mhm,
if they go to the place near them, they're going to have to pay out of pocket.
mhm,
I think that's unacceptable. We're not taking care of our veterans. One of the things that is frustrating, and I've seen this before, is where a veteran needs to get care, their closest VA hospital is too far away, and it's an emergent situation, and they go to their local hospital, and the staff doesn't write down like any benefit information for that VA person. They don't get a pre-authorization,
mhm,
and then that bill comes to the coding department. We try to call VA and say, hey, can we get a retroactive authorization? Every other insurance company I've ever talked to is like, yeah, sure, no problem. Not the VA.
hmm,
They don't do retroactive claims, which means that that poor veteran that had to emergently go to the hospital nearby is probably going to have to pay that bill out of pocket. And we talked about how much that costs earlier.
yeah, yeah.
That's crazy to me. There is a system that they use called the Veterans Health Information Exchange, and that's how they can like communicate and get electronic health records and stuff. But I don't feel like the registration staff is well enough versed in some of these hospitals.
Yeah,
Um,
I was gonna ask you why they're not using it if it's there. Like,
Right.
it doesn't seem to
Right.
be in use to me. So, like, I
Exactly.
and it's not even just when you go to the emergency room, honestly. Let me just say, from personal experience, I had 2 children, and the VA, you cannot they don't take care of children, and they don't take care of the birthing, process or any of that, anything leading up to it. So, we have to be outsourced, basically, to these other places, these other clinics. So, even for routine scheduled visits, and every time you go to check in, they're like, "Okay, I see your appointment. Where's do you have your insurance card?" "Okay, I'm don't have insurance. I'm through the VA." This is every single time, this is the hassle that I have to go through, and then sometimes I have to wait because they don't know what even how to figure it out, or they're asking me these 50 million questions that I've answered 50 million other times, so I'm not in the mood for it, and, like, there's all this hassle attached to it, even when it's a routine scheduled visit.
I attribute some of that to the training of the front desk staff. I've seen this myself where they don't know what information to get because they're not trained enough in that
Mhm,
subject. And that's one thing as an educator I can tell you is that they don't teach enough about different insurance and stuff
mhm,
to billers, coders, doctors, nurses until you're actually in the job. Once you're in the job and doing the work is when you learn, and there's not enough training in that area. There definitely needs to be a lot done in how they collect veterans information, making sure they follow all the steps. Does this vet need a pre-authorization? Do I need to call? Because there's that VHIE system I told you about. Then there's
mhm.
also a national call center number that they could call.
Seems to me from what you've told me that the whole darn thing is not very encouraging.
It really isn't. We need to do a serious overhaul of our system and pull this money out from these greedy hands. We could take care of our people, and switching to preventative healthcare will help prevent some of those bigger healthcare costs. Again, if we're limiting those healthcare costs, premiums go down. We don't have to spend as much overall for healthcare for everyone if we're going to the doctor regularly. We have to take the stigma out of going to the doctor out of it. People can live happy and healthy lives in the United States. Being a woman in our country and seeing maternal fetal mortality rates be as high as they are when we say we're the best country is just crazy to me. As a woman, knowing that only till recently did ACOG, which is like the Association for OB providers, finally acknowledge that women need pain medicine for procedures done in the office. I'm
Wow.
why I'm talking about like IUD insertions, cervical biopsies, colposcopies, stuff like that.
Right.
Those are being done without pain medication, are still being done without pain medication in many circumstances. It's just finally ACOG has come out and said, yeah, women really probably do need some pain medicine.
You think?
Of course we do. Hello.
Hello.
But
Hello.
women's healthcare is so behind because our
Yeah,
system doesn't prioritize that. We
yeah,
have so much to do. That just focusing on that, maternal fetal mortality rates would also help the longevity of our society. Obviously, if we have healthier mothers and healthier babies, that rolls downstream.
yeah.
We need some industry changes too. So, like the things I talked about are more like legislation, but we also need to streamline the billing process so that
Mm.
claims are processed quicker because I'm sick and tired of things taking so long because insurance companies keep denying things. And then the
Mm.
patient ends up getting a bill a year later. We definitely need to involve more industry professionals in fraud, waste, and abuse to ensure proper oversight because providers at the top of the system, they benefit from this system. That's a conflict of interest, and I don't think that they should be as heavily involved, nor do they understand the background of healthcare because I can tell you that physicians don't take a specific class to learn about all this stuff that I'm telling you. If they're lucky, they'll get to sit with somebody like me that tells them that for maybe one afternoon for a couple hours.
Yeah, now wouldn't universal health care in and of itself kind of take care of a lot of these issues too?
Yes.
Yeah. Yeah.
The streamlining of claims, yes, absolutely. It also would reduce administrative burden for physicians and staff because they're not having to try to figure out what this particular insurance is going to cover. That's a pain in the butt. All the pre-authorization process for different insurance companies,
Right.
because there's a lot of shady stuff that happens on the back end. And we need to ensure that the CEOs of our healthcare entities are certified healthcare professionals with experience, not tech bros that treat
Mm.
us like numbers and not human beings.
Amen, sister.
So going back to women's rights and bodily autonomy, right? When we saw Roe versus Wade overturned, that's when we started seeing increased numbers of women dying from sepsis because they're not getting the
Mm.
health care that they need. And it really bothers me that physicians have to go against their Hippocratic oath to do no harm because the law for that state says that they may end up in jail for providing health care. It has to get to a point where the patient has sepsis and they might die in order to intervene. And I just think that's insane. Why are we prioritizing a religious ideology over the health of women
Mm-hmm.
and not giving women their right to choose? Like because there's long-term health implications of having severe sepsis. Like, and
Mm.
again, think about how much that costs for that patient to be in the hospital. One of the most egregious things I see is the heartbeat law. Once a baby has a heartbeat, you can no longer perform abortive services,
Oh.
which a lot of times women aren't even seen by their OB providers for their very first ultrasound scan until about 10 weeks because the baby's not big enough to be able to confirm
Some don't even
pregnancy,
know
find a
they're
heartbeat.
pregnant. Yeah, like,
Exactly.
what the
Exactly.
actual.
And there's a lot of misconception, and we had this conversation in one of your lives where there's a lot of bad things said about Planned Parenthood
Mm.
specifically
Mhm.
performing abortive services, that they perform abortive services on full-term babies, which is absolutely not the case. Um, that's murder. That's
Mhm.
illegal. Those physicians would be charged with murder. That does not happen. We
Yeah.
hear that because of all of the propaganda that is put out from the conservative groups. Typically, these are religious groups. The ones that you see outside of Planned Parenthood that
Mhm.
are intimidating patients as they walk in, probably to make one of the hardest decisions of their lives,
Yeah.
um,
Yeah.
shaming them. Yeah,
Last thing anybody needs in that moment of their lives.
I'll say it every day. Men should not make decisions about women's bodies. I'll say it over
Amen.
and over again.
I'm right there with you.
And then another part of this, we're seeing women in labor in the hospital where they're saying, hey, the doctor's saying, hey, I think it's about time that we consider C-section. And the patient says, no, I'm not ready for that, which is their right. The
Mhm.
doctors there should be there to advise, but ultimately the decision is the patient's. And then this is an actual story you can look up. A patient said, no, I'm not ready for a C-section. Doctor comes back with a judge on the phone
Mm.
and they forced her to have a C-section.
Why exactly?
They said they claimed about the risk of the baby, but it does not seem justified. The woman herself
I.
is a doula. It's not like she
Mm.
was unfamiliar with birth and the birthing process. So, yeah, again, it comes down to the doctor doesn't want to be liable for
Mm.
this. We see women get denied health care by their doctors because their own personal beliefs. I've seen this. I've seen women get delay of care because of it. There's also women that are coming in labor. Remember EMTALA, they have to see the patient in
Mhm.
labor and determine if they're stable. Well, there's pregnant women, a lot of them women of color coming in and in labor and either being very briefly assessed or not assessed by a physician at all. And they are saying, nope, sorry, you're not far enough along. We have to discharge you. And so they're pushing these women out of the hospital, and these women are giving birth in their cars.
No.
Yes. It is happening.
You said these, like, there's more than like, this is a thing going
Yes.
on? Oh my
Y
gosh.
yes, and it's awful. I highly recommend looking into it because I have chills right now just talking about it, thinking of all those women that weren't listened to
These
by their healthcare providers because it's a business, they don't have time for them, and they let them out of the doors, and then those poor women are scared and alone having to give birth
mm,
to their children
yeah.
without sufficient healthcare. Around 80% of maternal deaths in the United States are considered preventable.
Wow.
Yeah. Yeah.
Wow.
The maternal mortality rate in the United States is 18 deaths per 100,000 live births, which is more than 3 times higher than most other high-income countries.
We sure know how to
So
win
that
at some shitty shit, don't we?
I'm telling you. And again, what do those other high-income countries have that we don't? Universal health care.
Universal healthcare, yeah, yes, ma'am.
It all
Wow.
goes back. It all goes back.
Thank you for those facts. I hope your expertise and your years of knowledge in the field will help to get people to realize how it actually works, and that's kind of the point, obviously, of doing this.
Happy to do so anytime. We need to vote in representatives that actually represent us, that
Mhm.
have our best interests at heart, that want to overturn the system. It's got to start with us voting in the appropriate people so we can make these changes. Otherwise, we're
Again,
stuck in this system.
yeah,
Yeah.
awesome. There you have it, folks. Of
Yeah,
course.
I'm doing a live on TikTok Wednesday um, about fraud, waste, and abuse.
Okay,
So
cool.
if you want to hop in there, I'm going to be dropping some more knowledge then
Love it,
about
love
this
it. I
whole
was
thing.
at your last live, and that was amazing. That was very knowledgeable and, oh, again, mind-blowing. If you go to SteffiWuffy123 on TikTok to be informed as a society and make some good decisions here moving forward. Lord knows we need all we can get. What time?
6 p.m. Central Time.
Audience, thank you for listening. Thank you for being here. Please share this content, and hopefully we will see you right here on From Dirt We Grow next week. Thank you.
Thank you.